Hello, hi guys. Hi, Dr. Ali here on the Two Docs podcast together with
Dr. Ingky, and welcome to the podcast whereby two medical doctors generally speak on things where I'm non-medical, but this month itself is very special.
Last month special, this month also special.
Every month is special, right?
Yeah.
So,
Next month Christmas, don't know what's special yet.
That one is Christmas special.
Correct. But for now, it's November. We are talking about Sexual Health Awareness Month.
Correct.
And we've had a couple of episodes already.
Yes.
And last week was also a very interesting topic, was living with HIV. So if you guys want to check it out, last episode, living with HIV, I think it's not just for the patient, but for the people around.
Yes,
what you should know, what you don't, what you should know more, rather than forming discriminative or having prejudgments of people living with HIV.
Yeah.
Now this week we've got a special guest.
Yeah, so this week we have a special guest. So we're going to ask our guest to introduce herself. All right, Wani, take it on. Take it away.
Hi, I'm Wani Ardy. People call me Wani. So I am the founder of MRKH Malaysia, which is a support group for women born with MRK syndrome. I am also a peer support specialist for women with sexual and intimacy issues, especially women born with disorders in sexual development and rare disorders.
Oh,
All right. So it's very, very interesting because we also we get doctors, all right, occasionally, but most of the time we get non-medical doctors,
Yes,
right? Or we get people outside the healthcare profession. But the one thing that we want to highlight is we want to assist people, all right, or we want to talk about the human nature of stuff, and we want to talk about topics that nobody wants to talk about.
Correct. This week is a very, very interesting topic.
Yeah. So to this week's topic is female sexual anxiety.
Sexual anxiety.
Sexual anxiety amongst females.
Yeah. So I think it's a very taboo topic. People don't really talk much about sexual anxiety. In fact, when it comes to sex, it's always the guy that's talking about it most of the time. And even when we see a lot of things, they talk about male sexual performance, male sexual anxiety in that sense because of the whole erectile dysfunction and I think the whole pharmacy world that can make money out of it. However, with female sexual anxiety, it's not as straightforward.
Yeah, it's not as straightforward.
straightforward.
Yeah. So,
And
Wani, could you
tell us more?
Tell us a little bit more about female sexual anxiety.
Okay, so basically, female sexual anxiety is when a female experiences anxiety, any sort of anxiety that is related to sexual and intimacy. So this is usually due to so many factors. Sometimes it could be a past trauma. Maybe she was sexually assaulted or sexually harassed, or maybe she was sexually abused as a child. It could also be due to her upbringing. Maybe she had a very, strict and religious upbringing, or maybe she was born in a family that is very traditional and conventional, that has no exposure whatsoever on sexual health, sexual education. And sometimes it could also be due to certain conditions such as vaginismus, whereby the muscle of the vagina, shut off automatically whenever penetration wants to happen. So yeah, there's so many reasons why anxiety could happen. Sometimes it could also be due to body image, high level of insecurity, due to obesity, or sometimes women with breast cancer, maybe they have scarring, one breast left, so they feel very insecure about their body, and then they develop anxiety every time they're about to have sexual intimacy.
Interesting.
What would be the I would say top 3 or top 5 causes? Because you've listed quite a few.
Yeah.
However, since we're in Malaysia, and of course it's again not a very commonly spoken about topic, and as long as you don't speak about it, we men are worse. We don't know about it. Yeah. So what would be the top 3 or top 5 causes of sexual anxiety among women in Malaysia specifically?
Okay. I'm trying to recall from the cases that I've handled. Most of them are, like, for my clients, Muslim Malay women who were brought up in very conventional, traditional upbringing, very strict, very religious, and they're not exposed to any sex education, and it is very taboo, a very taboo topic to talk about. So sex is being seen as something that they should be scared of, you know, as something that is just an aspect of health, you know, just another part of health, just like mental health or sexual health. They don't see it that way. They see it as a sin, see it as something dirty. So they had to go from that point 0 to point 10 after marriage. Like suddenly, okay, when will you have children? So it's a huge leap. So that gives them so much anxiety. Like, how do I leap from point 0, not knowing anything about sex, and suddenly needing to make babies? So that's number one. Number two, there's a lot of instances where an issue of porn addiction. So porn addiction is something that female has as well. You know, usually when we talk about porn, we would generalize it just men, you know, men having porn addiction. Actually, there's a lot of women who have porn addiction as well. And it totally distorted their idea of sex. So they thought that, you know, sex has to be this way, whatever that they've seen on porn movies and porn films. So they have totally false idea of sexual intimacy. I have to look a certain way. I have to be, I have to have a certain body figure. The sex position has to be this way for it to be pleasurable. I have to reach 3 times orgasm in an hour for it to be an ideal, you know, sex, for me to have an ideal marriage, for example.
Do they ever feel that the partner must look like, you know, that white guy with 6-pack?
That's the thing.
And suddenly they end up seeing, you know, wow, this guy like quite plain, huh?
That's the thing. They are very forgivable when it comes to their husband. So their husband can look just the way he is,
just the way it is.
but they self-blame a lot.
Right.
A lot of guilt, a lot of shame on how they look like. So they think, oh, I'm not pretty enough, I'm not thin enough, my breasts are not big enough, you know. So yeah, false idea of sex due to porn addiction. And number 3, vaginismus, because vaginismus is actually more common than we think. It's just that women don't talk about it. It's something that's very shameful, very embarrassing for them. Many women don't want to admit that they've been married for a month or a year, but still they couldn't get that penetrative sex. So it's something that they don't want to admit, but that is a huge sign of vaginismus. Yeah.
Wow.
All right. So for our listeners, vaginismus is actually a condition whereby there's that hypercontraction of the vaginal muscles, making penetrative sex very
painful,
very
unpleasurable,
painful, unpleasurable, and sometimes close to impossible.
Yes. So think of it as cramp.
Yeah.
It just cramp up, and anything that goes near it, it hurts.
Yeah. Correct.
Is it more physical pain or is it a mental pain with vaginismus? I'm just curious.
I would say both.
Both, yeah?
Yeah, because psychological, of course, but it's something that is curable. I remember there was this one client who came to me with vaginismus, and it took her a couple of years before she could finally, you know, have penetrative sex. And well, she has 2 children now.
Okay.
So it's definitely curable. It's just that it will take a long time and a lot of practice through dilation therapy, and sometimes, you know, just intimacy practice with husband, because some women, they get anxious just lying down without any clothes on, side by side with their husband. Just lying down, they feel very anxious already. So not even talking about trying to having intercourse, penetrate or anything, just the idea of going naked side by side. So I think it's very important to tackle the intimacy part first before going straight to the sexual part. Yeah.
Guys, we are talking about sex. This week is Sexual Awareness Month, and we are talking about female sexual anxiety. And with us is Wani. Right. So when it comes to this, you listed three things. One is of course the upbringing. Right.
Yep.
When it comes to upbringing, right, is there a difference between let's say predominantly Malay thinking, or also let's say the non-Malays also have this kind of thinking of poor upbringing, or thinking of it as not being of being dirty, or not something that they should be more open about?
Even though it's majority it's Malay Muslim, but there's also Chinese, Indian, who came to me with similar similar reason, the upbringing, the very religious, strict family, because I think it's a very Asian thing lah. I wouldn't say it a Malay thing. It's an Asian thing, because we're the very, how do you say it, very malu-malu type, right? The Asian people, we are very shy, very conservative. Like everything has to be covered, and everything has to be very prim and proper. Like it's not nice for you to talk about sex with your family, with even with your mother. A lot of women, they don't even talk about it with their mother. So they really don't have anywhere to turn to when it comes to, especially an issue such as vaginismus, because it's so private, right? We're talking about penetrative sex. This is not about holding hands, or I'm not having quality time with my husband. We don't go dating anymore. This is about penetrative sex. So it's very, very private. So they keep it to themselves a lot. Yeah. Asian people.
All right. So let's say if someone is already married, all right, and they have issues with penetrative sex, now, what is the first step that the woman should do? All right. Let's say if they discover, hey, you know what, I find it really, really uncomfortable, right, to actually have penetrative sex. Who should they reach out to? Right, the first person to reach out to. Should they reach out to a healthcare professional first? Should they reach out to the family and friends first? Who should they reach out to?
I believe the first person they should reach out to is the husband. It's always, communication is always the key. Sometimes women, not to generalize, sometimes women, they expect their husband to be able to read their minds, kind of. And
No, not sometimes.
No, it's all times.
It's not sometimes.
I'm trying to be nice to my gender.
It's okay.
And I can tell you honestly, we can't read your mind.
We can't read your mind. See, we can't read your mind. We can't read what you're trying to tell us too.
We can't read your mind.
Yeah,
Prime
so
example.
it's so important to tell your husband that I can't do this. I am not ready for this, even though we are married. Okay, for Asian people, I don't know why. I'm not sure about. Okay, I'm gonna talk on behalf of Malay Muslim. Please correct me if I'm wrong. Is it the same for Chinese people? Like for us, the first night is always like so much pressure on the first night. First night has to be magical. Of course, premarital sex happen anywhere, but ideally, our parents want sex to happen after marriage, right? So first night, there's always pressure of you have to perform on the first night. First night, penetrative sex has to happen. And this puts a lot of pressure on Malay Muslim women primarily. They thought that the first night, penetrative sex have to happen, which is false. It doesn't have to happen. Nothing have to happen on the first night. So you're so tired from the wedding already, right?
Yeah, right.
Yep.
Yeah. So it can just be like both of you lying and talking, lying down and talking, just spending quality time. Nothing have to happen if you're too tired. You don't need to force yourself or push yourself. So first thing first, if you're not ready for it, you have to let your husband know, so that he doesn't have the expectation of,
That he has to perform too.
Yeah. Because men always have that, the feeling of having that responsibility, that pressure of, I have to, perform or something. And women, on the other hand, women have this pressure of, I have to serve my husband. Serve my husband, have to give myself to my husband. this is something that they need to communicate with each other, and like decide when you are ready for it. If you're not ready for it, it has to be a mutual agreement. It's totally okay. Like the first week of marriage, you're not ready, it's fine. But it has to be mutual lah.
Yep.
Correct.
Right?
Yep.
You have to tell your husband, I'm not ready for this. Can we take it slow? Maybe start with cuddling first, hugging and kissing and things like that, and then slowly on to the next stage. Something that I realized is that a lot of couple, they skip the intimacy part and they go straight to the sexual part. You cannot skip the intimacy part. Relationship is your foreplay. Foreplay doesn't just happen in bed.
Okay.
Foreplay happen outside of the bedroom. Men, when you wash dishes, that's foreplay.
It is?
It is.
So tonight he'll be like
When you
sleepless,
sweeping,
washing dishes.
when you
No,
sweep the
I
floor,
have to shut down the dishwasher first.
you mop. That's
the
all
dishwasher gets more
foreplay.
attention than me.
Yeah, seriously. So your relationship is your foreplay. Foreplay doesn't just happen in bed. So before you go straight to penetrative sex, which is a huge leap, go back to your relationship first. That foreplay first, the intimacy part. Do you even hold hands? If you don't even hold hands, how are you going to jump from that to penetrative sex?
True,
So
true.
yeah.
Well, I will answer the Chinese bit on why there's a difference between the Malays and the Chinese. So Malays, a lot of P. Ramlee film also show, right? You
Yes.
can go in and the mother-in-law will be there waiting. The whole kampong will be waiting for something to happen. Chinese a bit different. They
Okay.
make sure that the guy Yam Sing till he's so drunk, right?
cannot-
She doesn't need to do anything with him for 1 week.
Yes, exactly. Exactly.
Wow, really?
Yeah,
I didn't
really,
know.
Really.
Personal experience. My wedding day, I got so drunk. Someone had to carry me to the room. Right,
He woke up 2 days later.
My friends had to carry me to the room, so really nothing happened.
No anxiety.
Anxiety.
But that's
Wow.
cultural. That's cultural.
Yeah,
Totally
new
different.
knowledge for me.
We need an Indian one today, Pashwin. Next
How-
day must tell us, eh? Okay. So I think that raises a very interesting point when it comes to the sexual anxiety, especially on the first night. I think a lot of people do not know that it's okay to not do anything on the first night.
Yes.
Would that be something of, let's say, a lack of education? Let's say maybe in school or in uni or somewhere along the line. I mean, where should this fall into? Because if it's a traditional parent, obviously they're not going to tell you, nah, it's okay, first night, don't do anything, it's all right. They're not going to say that, right? I mean, they should, but they don't. Where do you think this thing falls lacking? Which hole that it has fallen into whereby no one's talking about this at all?
I think when sex become a very taboo issue, an issue that we avoid all throughout school, school, university, and then finally when the person gets married, it become like a big freedom of, okay, let's try like the biggest thing, Whereas if we don't make it a taboo issue, it's just part of life, just part of health. So when you get married, it's something that naturally happens. You want to do it, you do it. You don't want to do it, it's fine. So it takes the glory out of it. You get what I mean?
I understand.
Yep,
So
I
if
understand.
you keep
takes the pressure out of it,
basically.
if you keep suppressing the feeling, and then it will explode on the first night. You have all this pressure of, oh wow, I have to perform something that I've never learned all my life. So it's a huge pressure from 0 to 10.
All right. So where should the conversation begin? Right. So because we mentioned a lot of times is about adult men and adult women not knowing about sex. So where should the conversation begin in the first place? When should it begin? How old should people be educated about sex, and where? Is it in the home? Is it in school? Where? At what age first?
I have a 10-year-old. I do talk about sex with him, but of course I do it stage by stage. So for now, I just talk about it on the surface, like how babies are made. You know, mom and dad, they cuddle, they kiss, and that's it. They sleep together, and then a baby happened. So to me, that is already my introduction to sex, and I said, that is sex, you know, sleeping together, cuddle and kiss, just the two of you without clothes, and that's it. So I think conversation definitely have to happen from school and not just textbook, not the stuff that we learn in textbook, because textbook is so scientific and so straightforward, like, you know,
Nobody
okay,
learns
this
about
is
sex from
anatomy, next chapter.
Nobody learns sex from there. Sex education is from pornography.
Yeah.
Yes.
Yeah, and pornography is always down straight into the action, and I think
Exactly.
what you said about pornography addiction falls into play, because if that is the norm of what you see sex is going to be, then you thought, you know, on the day that's going to happen, it's
You're supposed to live up to that.
expectation, and it's full on straight direct into the
Yeah.
action. There's no foreplay, there's nothing at all.
Yeah.
How about premarital counseling? Should premarital counseling include this kind of topics in, rather than just talking about marriage as a whole? I think that's
Definitely,
I think that's
yes.
something that's lacking when it comes to premarital counseling. Even in the Muslim community, when they go for their pre-marriage counseling, they don't add sex in as a topic,
They add sex in as a joke.
as a joke.
Yeah.
How they joke
Dirty
about it?
jokes.
Oh, dirty joke.
Yeah.
All right. So they're sort of like telling the woman it's okay
That's-
if to let the husband do what he wants, kind of thing, or what?
Okay, make sure your husband is satisfied. You know, it's your responsibility.
But that
things
adds
like
more anxiety. Doesn't it?
Yes, yes,
That definitely adds
definitely.
pressure.
Yeah. It's them trying to be very candid to
Yes.
say that, but in actual fact, it adds more anxiety rather than
Yeah.
saying, "Hey, it's okay if don't do it on the first night," you know, that kind of
Yes.
thing. Sex is
And
on your
I
own
remember
time.
during the course, like the men laugh about it, and us women are like,
Very shy. Yeah.
Creak, because there are so many other men around also
yes,
anyway.
yeah.
There'll be other men staring at each other's partner like, okay.
Yeah, I think it's very important in the premarital courses. It's so important to talk about the mental health and sexual health aspect of marriage. That is not being discussed. What's being discussed is the spiritual part of it, the religious part of it, the pressure, the responsibility, what to do, what not to do.
The expectations,
But yes, the expectations, but nothing on how marriage will affect us mentally, emotionally, sexually. You know, maybe like how early is too early, how often is too often, how do you communicate in bed with your partner, how do you communicate your sexual needs, nothing on that. So we've been jumping into marriage with zero knowledge on sexual and intimacy. Yeah.
Do you find also whether is there a difference for those who have, let's say, premarital sex? Do they suffer from anxiety as much, or mainly are those whereby they've never had, this is the first time, and therefore the anxiety is way much stronger?
I must say, first timers, they have more anxiety. This is, of course, purely just from my observation of my clients. Those who doing it for the first time, they have more anxiety than those who have done it before. But still, those who have done it before, sometimes they do have anxiety too, especially if they have bad experiences in the past. Yeah, bad experiences as in like they didn't have sex that they enjoyed. Like maybe the sex was forced. It was something that is that was very traumatizing. So that would definitely give them anxiety for the actual sex after marriage, which they think, you know, after marriage it should be better. That's what they thought.
Okay, it's sexual pleasure, all right? Do women find that it's much more difficult to achieve sexual or pleasure from sexual intercourse compared to men? Because I know men, it's simple, you know, most men enjoy the act of penetration, but I do understand that there are some women out there who do not enjoy, and at the same time, probably in their entire life have never enjoyed it. But do you see very
Duty,
often? Yeah.
Yes, because I think actually for women, there are so many ways for them to reach orgasm, and not just penetrative. Whereas for men, most men think that only through penetrative sex women could reach orgasm. Actually, there are so many parts on the body, so many spots where orgasm can happen, and not just through penetrative. So it's a matter of experimenting, a matter of exploring. Things become difficult when you stick to the same script again and again.
Okay.
So that happens a lot, especially husband and wife who are very traditional, very conventional. They have the same script. So they use the same script again and again. And at one point, the script doesn't work anymore. Yeah. So you have to experiment and explore. And a lot of people look at experimenting and exploring as something,
Leceh.
Jijik lah. It's like
it's
very yucky kind of
yeah,
dirty,
very yucky. But again, it comes down to communication. You have to communicate. Okay, how does this feel for you? Is this okay? Do you like it? Or okay, if you don't like it, okay, we try another part, another body part. Okay, is this okay? So a matter of talking. A lot of us, we don't want to talk while doing it, but that's the only way we could find out whether is it pleasurable for our partner or not. Are we comfortable or not?
Again, blame it on pornography. They only describe one G spot.
There's so many spots.
The elusive G.
The elusive G spot. They say it's there, but you'll never find it. But somehow everyone thinks there's only one same spot for everyone.
Correct.
So again, I think. Yeah. So this mic is getting a bit excited. Can't stay still.
No, it's drooping down already.
Yeah, it is.
Your mic is drooping down already.
Not as stiff as.
Yeah, it's not as stiff as not as straight as.
Okay, come back. I'm getting excited over my mic. My goodness. Yeah. So what are we talking about just now? G spots.
Talking about G-spots. Yes.
Right. So when you talk about experimenting and communication, how best do they communicate? Is it through reading, then they tell each other, or is it during the in the midst of intercourse, talk to one another more, or what is it that's lacking that usually you find in your clients?
Today we are living in a very textual world, right? Everything is very texty.
Okay.
We WhatsApp, and on social media we type. So I realized that for a lot of women, what works for them, when they don't have the courage to talk to their husband about their sexual needs, what works for them is they text. But of course, this is before going in bed lah. But also sometimes they lie down side by side. They're so malu to talk about it depan-depan, right?
Yeah.
Say
Text
they would, text. For me, whatever works.
Yeah.
To be honest, whatever works. Okay, can we do it tonight? And can we not do this position because I'm not comfortable with it? I actually prefer this position. Always tell what you prefer. Don't just tell your husband or your wife what you don't like, because that would make your partner feel macam, alah,
Everything I do is wrong.
Yeah.
And then
So
he also
always
gets
tell
anxiety.
your husband or your wife what you prefer. I like it when you do this instead. Remember that you did this one time, I really like it. Yeah. So always tell what's your preference.
Okay.
Yeah. And if texting works better for you, by all means, text away. And then the script will perform itself in bed.
Oh, okay.
Interesting.
You spoke about past experiences. We spoke about preventing sexual violence
Yes.
on our first episode on our sexual health awareness month. How often do you see women who have sexual violence? Not so much into rape per se or outsider, but within people of familiarity. How common is that? Which would then of course cause them to have future anxiety.
Yeah. I remember I handled this case where there was this woman. She's married, but when she was a child, she was sexually abused by her uncle. So she said that really left a mark on how she performed in bed with her husband. She has, all sorts of anxiety. She's very sensitive to touch. So yeah, all this kind of trauma, definitely, if it's not treated, it will be something that you carry in bed even 20, 30 years later. It will affect you forever. Especially, sexual violence, sexual abuse, sexual assault. These are all very traumatizing incidents that will leave a mark in your mental, in your mind, and you carry it for the rest of your life if you don't talk about it, if it's left untreated, if you don't see a psychiatrist, if you don't see a counselor and you talk about it, it will leave a mark, and it is something that will affect your husband, and your partner will think that he's not doing enough. I also have I also have a client whose husband was sexually molested. Her husband was sexually molested by an uncle as well.
All right.
So she said that her husband could not reach orgasm. Her husband has never reached orgasm, and finally, her husband opened up about his past, the fact that he was sexually molested, and she asked me, what can be done? So I said, your husband, right now, this is a mental health issue. Okay, we don't need to go to the sexual health issue first. Go and see a psychiatrist. Go to a psychiatry clinic. Get your husband treated. So that he can be treated for his PTSD. I believe it's PTSD. And after a while, it got so much better for them. The husband, went to see a psychiatrist and so many sessions and talk about PTSD and how to deal with it. And then finally, they get to have normal penetrative sex and reach orgasm. Yeah.
Okay. Let's talk a little bit about vaginismus. Again, how common does it always happen when it's first time, or can a woman still get it a little bit later in life?
Yeah.
Or even if it's let's say a second marriage, because let's address the elephant in the room. Sometimes there'll be things don't work out. You have a second marriage or a third. Does vaginismus recur back in this kind of situations?
Yes, it could happen. For example, let's say a woman who has put on so much weight, and she could have penetrative sex before putting so much weight, and after a few children, and after 10, 20 kilograms, and then she started developing vaginismus. So yes, it definitely can happen, depending on what's the factor, what's the reason behind it. So usually, when vaginismus recur, it's due to body image, this kind of thing. Or sometimes when a woman they face traumatizing incidents such as sexual violence, rape, and so on. So before rape, she could have sex, penetrative sex. After rape, she couldn't have it anymore. So definitely it can happen.
Okay. What should these women do? How do they go about? Who do they contact?
Yeah.
What can they do to get themselves improved? And is it always advisable to go with their partner straight up, or go by themselves first and bring the partner later?
Usually they would go by themselves first, talk about it with the doctor. I'm not sure about other hospital because I work closely with PPUKM, so we have doctors who are not just gynecologists that focus on sexual and reproductive issues. We also have gynecologists who specializes in sexual intimacy issues, including vaginismus. So this is the kind of doctor that you can go to and talk about the severity of your vaginismus. And then slowly we can bring your husband in, so that the husband definitely has to sit down and listen as well to what the doctor has to say, because vaginismus is something that cannot be cured without support system. You need a good support system. You need a good partner, a very attentive partner, and it's something that needs patience and time in order for it to be cured. It's not something that you can makan ubat today and tomorrow it's cured, right? So there's stages there's a lot of practice, a lot of methods, and a lot of therapy that would definitely help you in the long run. Yeah.
Would you say a partner's involvement contributes almost about 50% of the recovery?
Oh, more than that.
More than that?
Yes.
Okay.
Definitely more than that, because it's so important to have an understanding partner, knowing that penetrative sex is not everything, because for us Asian people, when we talk about sex, we would think about sexual intercourse. We would think about penetrative sex. When in truth, there's so many ways to explore sex. It's when we're talking about sexual activity, there's so many things that we can do with your partner. It's not just about penetrative sex. So vaginismus, women with vaginismus, they cannot enjoy penetrative sex. But there's so many other things that you can enjoy. So it is up to having an understanding partner for you to be able to explore those possibilities. So it's so important to have a husband who support you, who understand your condition. Okay, it's okay, sayang, if you cannot have penetrative sex today, let's try something else. You know, whatever that gives you pleasure, whatever that you're comfortable with, and then slowly we work towards that.
For the benefit of Malay listeners, how do they communicate the word penetrative sex in a conversation? I was just trying to think. It's in English it's easy, but in Malay, how do we say that? Or how are they going to communicate?
Can masuk or not?
Can masuk or not? Oh, okay.
Okay,
Your
that
question is good. I've never thought of that.
Yeah, because it's a communication thing.
Yes.
How are we going to breach that and say, but can masuk, I guess works.
Yeah.
Yeah.
Sakit lah, sakit bila masuk. Can we not do that? Can we try something else? Yeah.
Okay.
Interesting.
You're awfully quiet, huh?
Yeah. Because this is a really interesting topic.
Yeah.
Right.
But this is why texting can
Works.
be very helpful. Again, we're living in a very textual society.
Yes.
So
Yes.
texting can be very helpful. Even though 10 years ago we would say face to face lah, more sincere. Today it's not about sincere anymore.
Just get the job done first.
Yes, exactly.
Any form of
Whatever works.
communication.
Yeah.
Any
Yes.
form of communication
Yes.
works.
Okay. Well, so coming back to how are they going to get help? You're saying that you're attached with PPUKM. Is any other, let's say,
Yeah, are there any
Website or
hospitals,
whatever
any websites or any other support NGOs there that can actually help with this?
You can always find me through MRKH Malaysia. You can search for me, just type MRKH Malaysia. Or you can also type intim, intim.my on Instagram. So basically what I do is I give peer support consultation. When I say peer support, it's because I have experienced it myself. I have experienced sexual anxiety. I have experienced therapy that has been done by women with vaginismus and MRKH syndrome, because I was born without vagina. So I've lived that life without vagina and with vagina. So I give peer support consultation not just to MRKH women, but also to women with vaginismus, sexual anxiety, vaginal agenesis, vaginal hypoplasia. Let's say if you don't have any vagina at all, or maybe your vagina is short. So there's always ways that we can explore and things that we can do about therapy and things like that.
Okay. Yes, good.
for the benefit of the viewers, what does MRK stand for?
MRKH stands for Mayer-Rokitansky-Küster-Hauser syndrome. It's the name of 4 doctors who discovered the condition. It's a condition that happens to 1 in every 5,000 women. It's a rare disorder where women were born without uterus and without vagina.
Without uterus and without vagina.
Yep.
So the next session, the next episode, we'll be speaking on very, very intimately, specifically about MRKH.
All right, then stay tuned. Until then, we would like to thank Wani, and we'll be back next week with her
Thank
again
you.
on the Two Dogs.
Yeah. And that's it for me. I'm Dr. Ingky.
I'm Dr. Ali. We'll see you next time.
Yeah, see you next week.